use the restroom at all?
No.
Okay. Now, as I'm talking to her, some of the things I am noticing is that she is alert, she is oriented times 4, she is answering my questions appropriately, her skin tone is even, I don't see any cyanosis of the lips or nose, okay, she is making eye contact with me, okay, her mood is good, she's not, doesn't appear to be angry or upset in any way. Okay, so I'm going to move on. So first I'm going to start with your hair, okay? And I'm just going to check it, any pain or discomfort anywhere, okay? And then I'm going to move down to her ears. So what I'm looking for is any pain, any discomfort at all? No? Okay, can you open and close your jaw? Good, perfect for me. What I'm looking for is that Team J joint.
Yeah.
Thank you, joint. I'm looking for it to make sure it opens smoothly and it's not clicking or making any noise. There wasn't any pain in her ear. I'm going to take a look. I don't see any drainage coming out of either ear. Any problems with hearing at all?
No.
Okay. I'm going to look at her eyes. So I'm going to go from her ears for me. This is how I do it. I go from ears to eyes. I'm going to look at your eyes. The sclera is white. The conjunctiva is pink. Can you close your eyes for me? I'm going to try to open your lids, and don't let me do that. I am looking for muscle tone around her eyes. Okay. Now I'm going to pull out my trusty pen. Okay. And I'm going to flash a light in your eyes. Oh, before I get any farther, I do need to remind you guys, this is before we do the eyes, I would also start our assessment. Make sure that you mention that you would do a visual acuity test, okay? So that's over there, we did that, we're good. Okay. So now, I'm gonna take a look, and I'm looking for consensual and direct pupillary response. So just look at my nose for me. Okay. Again, is that too bright for you? Okay, good. So now, what I'd like you to do is just look at the end of this and watch it as I move it in. So what am I doing here, guys? Okay, good. All right. Next thing I'm going to do is I want you to follow the tip of this pen, and I'm going to move it, and I want you to follow it with your eyes without moving your head. So up, back, over, back, down, back, up, in, out, in, and down. Good. So I see no nystagmus, I see even movement of the eyes. They follow the object without any stuttering, and both of them are equal. Okay, now, I'm just gonna palpate here, any pain or discomfort?
No.
Okay, any pain or discomfort above your jaw at all?
No.
Okay. Can you plug one of your noses for me? Breathe through it. Any difficulty? Can you switch sides? Okay, any difficulty? Okay, I'm just going to take a peek. Okay. Midline, no drainage noted. All right. Next, I would like you to smile. Thank you. And then we are going to have you, I'm going to have you smile, stick out your tongue, move it side to side. Okay, good. All right, and I'm just going to take a look in your mouth, if you would. Okay, say ah. Okay, good. The mucous membrane is moist. The tonsils are +2. Pink. The lips are in good repair. They're moist. Okay, I see symmetry in her face. I do not see any. When she smiles and grins and grits her teeth, I do not see anything that is not symmetrical. And she moves her tongue side to side again, so that is even. Okay. Alrighty. Now I'm going to kind of move to the back, if you don't mind. Okay. And actually, just while I'm here, I'm going to check skin trigger real quick. Okay. Give a pinch, and she is well hydrated. There is no tenting of her skin. So when I move to the back, I'm going to do a couple things back here. Okay. I'm going to check to see if her trachea is midline. Her trachea is midline. I'm now going to palpate the cervical lymph nodes, and we're going to call them out as we go along. So we have the occipital, post-auricular, pre-auricular, tonsillary, submental. These are submandibular, submental. Yep, thank you. Okay, and you try to turn your head just a little bit here. And what am I feeling along here?
The deep
cervical.
Superficial cervical.
Yeah, the cervical.
Okay. I got deep. Okay, and we're just gonna do the other side along here. Okay, and have you shrug your shoulders for me? Okay, and I'm down. Now shrug your shoulders again and don't let me push them down. Okay, good. I'm gonna have you look that way. Okay, push against my hand. Okay, good. Look over that way and try and, okay, perfect. Try and touch your hand. Now, while I'm back here, I'm going to whisper a couple words and I'm gonna see if you can hear them, okay?
Softball.
Okay?
Pizza truck.
Oh, they heard it.
Baseball.
Okay. All right, did you ever been told that you have problems with your hearing at all? No, okay. All right, now just to make this easier for everyone, can you just flip around in the chair so your back is to them? I'm gonna have you like straddle the chair for me. Straddle the chair. Okay. Now, be nice. The reason I have her straddle the chair, because this is like dual purpose for me, okay? By having her put her arms in front of her, it's gonna open up that rib cage, okay? So the first thing I'm going to do is I'm going to inspect, okay? I don't see any difficulty breathing, the lung expansion is even, her shirt, if it's off, I'm looking at skin tone, and I'm also looking for lesions. All right, and right now I'm just gonna have you take a deep breath for me. Okay, we have equal chest expansion. Okay, now, can you say the word 99 for me?
99. 99. 99. 99. 99.
Okay, now, any pain or discomfort anywhere?
No.
No? Okay. All right, now I'm going to percuss. Okay, and I've heard resonance throughout the lung field. Now I'm going to listen. Okay, and every time I want you to take one full breath for me. And again. How you doing? You doing okay? A little lightheaded? Okay, good. All right, if I can have you move back and turn around for me. Okay, as she changes positions, I also noting, are her hips, and do they flex, the knees? I see good range of motion there. Okay. Now as I inspect the anterior chest, when I am again looking for that equal chest expansion, I'm also looking for heaves and lifts. I'm listening for audible sounds like coughing or anything else that might indicate a lung problem. But before I move on, I want to do what we call the AP transverse. So you just lift up your arm for me.
Do you do this, you do a sitting?
You can do it anytime you want to do it. And it looks like I have a 2-to-1 ratio going down midline. Okay, thank you for putting your hands out of the way for me. Okay? So now what I'm going to do is not only am I going to do the 99 and on the front, so we're going to do that again. Say 99.
99, 99, 99, 99, 99.
Okay. I'm also going to palpate. I'm also feeling the cardiac borders here while I'm here palpating your chest. I'm feeling for crepitus, lumps, bumps. I'm also feeling for any type of vibrations, heaves, and lifts, okay, along this. So I'm kind of doing a 2-for-1 while I'm here palpating her chest. Any pain or discomfort anywhere? Okay. All right, then I'm going to go ahead and percuss the chest. So let's get into this. Five places, okay? All right, now I'm gonna go ahead and listen. Take a deep breath for me. Okay. Now, I'm moving my way down. Fine. Okay, I'm going to feel her carotid pulse, one side at a time. All right. I'm going to listen for bruise. Now what I'm going to do is I'm going to listen to your heart. I just need you to breathe quietly for me, okay? And I'm going to do it twice. Now, if this was in a more private area, I definitely would have her use her hands to move her breast tissue out of the way, okay? Okay, I'm going to have you lean forward just a little bit for me. Thank you. have 84 in regular after a count of 1 full minute, okay? Now I'm just gonna flip this around, take another listen for me. So just as you were, just breathe easy. I'm listening for the low, turbulent sounds, extra sounds. Very good. All right, I'm gonna feel some pulses. All right. Those are good. Down here to the radial. Quick look at your hands, nice pink. Good capillary refill. Can I have you open your hands up for me, like that? And don't let me squish your fingers together when I do this, okay? All right, good. Now, I'm gonna have you put your hands up like this, push against them. All right, good. Now turn your hands the other way, and don't let me pull them down. Okay, good, great. Skin is smooth, it's cool to touch, it's dry, and does not feel, it has moisture to it, it doesn't feel scaly dry, okay? Next thing I'm gonna do, we're gonna get into that bed, but I'm gonna have you stand up and we're gonna do just a couple things with our arms, okay? All right, just follow me. Sure. Hands out like this, and up and back, behind your head. Okay, and again, lift it back up, out, down, bend them, and stick them in the small of your back. Great, I appreciate that. Okay, you wanna come over here to the bed? I'm noticing that her gait is even, she has ease of motion, range of motion in all of her joints. You can just sit in your bottom right here. What I want you to do is, there we go. I'm adjusting to the bed to about a 45-degree angle. So you put your head here, keep right up here. Okay. Flashlight. Did I lose it somewhere? Oh, there it is. All right, just lay your head down. I'm gonna look for jugular vein distension. I'm gonna have you look over there for a second. Using my light, I like to get a reflection to see if I can see if this vessel is distended, and I don't see it. Okay, you wanna look towards me? Sorry about my arm. And I don't see any jugular vein distension. Okay, now I'm gonna lay you all the way down, all right? Any discomfort going flat? Would help if I knew a button to push. There we go. Alrighty, so I'm going to inspect the abdomen. Okay, I'm looking for contour. I'm looking for any pulsations, any bumps, lumps. I'm also looking to see if the skin tone matches the rest of her body. It's a good place to look for that. I'm going to look to see if there's any vascularity, striae, scarring, anything of her abdomen. So we'll call her abdomen flat. I see nothing abnormal, okay?
Flat.
We'll be kind. Just like mine's flat. Okay, so then what I'm going to do is I'm going to take my stethoscope and I'm going to make sure it's on the diaphragm, and I am going to start listening from the right quadrant, and I'm going to move right lower quadrant, and I'm going to move my way around. Next, I'm gonna take the valve of my stethoscope and I'm going to listen for any bruise. Taking my hand, finding her belly button, using it as a marker. Aorta. Renal. Renal. Iliac. Iliac. Okay. All right. Now I'm going to play you like a drum. I'm going to percuss. And I know if I go over the bladder, I'm going to get a dull sound. Okay. Now I'm going to, any pain or tenderness anywhere? Okay. So I'm just going to kind of feel around a little bit. Okay.
Make a scene.
Great. Okay. Almost done. Okay. Any pain or discomfort? Okay. I don't notice any edema. I also did not notice any edema in the upper extremities. No pain or discomfort. Okay. No edema. Edema. Okay. Bilateral posterior tibial. Pedal. Okay. Capillary refill. Less than 3 seconds. Okay, a couple more things. I want you to point your toes to your head. Okay, and push back. Push against my hands. Good. Now I'm going to bring your, there you go. Don't let me pull them down. Perfect. Okay. While you're still laying there, I'm going to have you do one more thing. I'd like to have you lift your head up and touch your chin to your chest if you can. Okay, I'm looking for any hernias. Perfect. You can let it down now. Okay, perfect. I'm looking for any hernias. Okay, any questions? Okay, come on up. Free range of motion with all of her limbs and joints. Okay, you can have a seat right back over here. Thank you very much. Okay, we're done. Did I miss anything?